Do you need to take vitamin D3 as a supplement? My name is Dr. Brad Fackrell, and this is Nacho, and we're from Synergy Spoke. Now today, I want to discuss a study that shows how important it is for you and your children to supplement with vitamin D3 every day of your life. Now, the information in this video comes from a study in the journal Nutrients in 2025, and I'll link that article in the description. Here are some quotes from that article. Vitamin D offers numerous under-recognized health benefits beyond its well-known role in musculoskeletal health. It is vital for extrarenal tissues, prenatal health, brain function, immunity, pregnancy, cancer prevention, and cardiovascular health. Existing guidelines issued by governmental and health organizations are bone-centric and largely overlook the above-mentioned extraskeletal benefits and optimal thresholds for vitamin D3. In addition, they rely on randomized controlled trials, RCTs, which seldom show benefits due to high baseline concentrations, moderate supplementation doses, and flawed study designs. This review emphasizes the findings from prospective cohort studies showing that higher concentrations reduce the risks of major diseases and mortality, including pregnancy and birth outcomes. Serum concentrations greater than 30 nanograms per milliliter significantly lower disease and mortality risk compared to less than 20 nanograms per milliliter. Furthermore, a daily dose between 4,000 to 6,000 IUs of vitamin D3 to achieve serum levels between 40 and 70 nanograms per milliliter would provide greater protection against many adverse health outcomes. Future guidelines and recommendations should integrate the findings from observational prospective cohort studies and well-designed RCTs to improve public health and personalized care. Let me summarize. According to 27 of the top vitamin D researchers, supplementing 4,000 to 6,000 IUs vitamin D3 every day will get your serum vitamin D levels to between 40 and 70 nanograms per milliliter, and that level will reduce your risk of getting cancer, autoimmune diseases, cardiovascular diseases, and diabetes. These researchers were very clear that a vitamin D deficiency will increase your risk of autoimmune and infectious diseases, cardiorespiratory diseases, impaired muscle function and strength, diabetes, cancer incidence and mortality, and acute COVID-19 severity and long COVID risk. Now, people ask me all the time, can I get enough vitamin D by being outside a lot like this? Well, that's a fair question. Remember, the goal is sufficiency. Having your serum levels between 40 and 70 nanograms per milliliter. In order to reach that, the average person would need to be outside every day at least 30 minutes, completely naked, between 10 and 2. But even that would not be adequate for those of us in the northern hemisphere 6 months out of the year. It is simply more practical for most of us to take a vitamin D3 supplement every day of our lives. And it's so inexpensive. The bottom line is being vitamin D sufficient is for your whole body health, not just your bone health. Now, I appreciate you watching this video. Synergy Spoke is a nonprofit organization dedicated to providing evidence-based information to help you in being proactive in your healthcare choices. If you feel like the information in this video was helpful, would you please give it a thumbs up and share it with a friend or a family member? And if you haven't already, please subscribe to our channel. That will help you get notified when we post a new video, and it will help our channel grow and reach more people and help them also. Now, if you'd like to stick around for just a minute, you can see some clips of one of my most recent mountain bike rides out here in the beautiful sunshine of New Mexico. I hope you have an absolutely wonderful day. Today we are in Glorieta, New Mexico. This is a trail called Chili Dog, which is a fun downhill section. And as you can see, not only is my buddy fully clothed, he is also wearing elbow guards and knee guards, and of course a helmet. We always wear helmets. And as a result of that, we are not going to be collecting very much vitamin D naturally. So therefore, that is why we must supplement with extra vitamin D. Why do we do that? Well, we just want to be healthy, but it'll also minimize our chances of fracturing anything if we do take a spill on some of those rocks that you see there. Hope you have a great day.